homestead. This morning, he traveled to the small Montgomery County town of Troy, where he toured a hospital. Channel 9's Bill Coy was there.
I'm very excited. I'm a teacher here. This is my school, Troy Elementary School, and I've been up since 6:30 this morning, and I couldn't wait to get out here.
It was a spectacle never seen before in Troy. The President of the United States shaking hands, working the crowd, all in the name of health care reform. And the people who turned out weren't just there to stargaze, they had questions.
As I get older and my husband gets older, what kind of health care are we going to get?
What can be done to encourage doctors to come to small rural areas?
The President was given a tour of Montgomery County Memorial Hospital, where the doctor shortage is all too real. There are only 3 doctors in the community. Recruiting new doctors nearly impossible. In that context, the President held a town meeting pushing for guaranteed health coverage.
This is not a political deal. Everybody gets sick regardless of their political party. And this country needs a health care system where the financing is as good as the medical care.
They are calling this the biggest event ever in Montgomery County. No sitting president has ever visited here before. And it's here that President Clinton told the locals that doing nothing about health care is no longer an option. Bill Coy, Channel 9 Eyewitness News in Troy.
And President Clinton's day is not over yet. He returned to Fort Mill this afternoon for a private reception with supporters, and in a little more than 2 hours, he will be back in Charlotte for a 90-minute town meeting. The topic of his nationally televised meeting, health care. Then it's back to Washington.
Today, the president's focus is on health care, but last night,
and said again today that if you're working, you and your employer pay, and if you're unemployed, the government picks up the tab. Now, next at 5:30, a closer look at exactly what the president had to pitch today, specifics on his health care plan.
And by the way, tonight the president will also be conducting a live
trip to Troy quite skeptically, saying the president had been on any number of similar fact-finding trips. Another one just wasn't necessary. And they asked the president if this just wasn't another attempt to push health care reform into the local television and local newspapers. And the president said, sure, and there's nothing wrong with that. Well, that's the skeptical national press corps. As for the folks in Troy, they were all smiles, absolutely thrilled that the president had picked their small town from which to start his latest push for health care reform.
Jim, there has been some criticism that a lot of Americans, not all, but a lot of Americans still don't understand his health care plan. You were in the room, you've heard it firsthand now. Did he give a good, straight, simple explanation of it? An understandable explanation?
Charlie, he certainly gave a simple explanation. There's no question about that, and you'll see that as he starts to push this next chapter of the battle of health care reform across the country. Everything is boiled down into kind of, as I showed you, bottom lines. There were 5 of them today. And the problem is you're dealing with 1,300 plus pages of a health care reform bill. So can you boil down 1,300 pages to 5 lines? Not very easily, but the president's doing his best to try to simplify the message in the hopes of getting more people onto his bandwagon.
All right, Jim, thank you very much.
And you know, you can't leave. I mean, it's like leaving your family. You know?
Administrators worry unless the president implements a plan to attract more doctors to rural areas, newly graduated medical students will continue to overlook the country needs for more money.
We're concerned that the wealthier urban areas will suck up because the demand will rise there. It'll stay the same in the rural areas. All the physicians and nurse practitioners and everything will be bid out. Not only new ones won't go there, but they'll be bid out to go to the urban areas. So we think it's imperative that we don't do universal coverage in a piecemeal way, that we do the whole thing so that everybody's entitled.
The panel asked the president to consider several incentives, like repaying student loans, tax credits, and tax breaks to lure them into the rural areas. The president says that's the backbone to his cause.
So what I'm trying to do is to get out here and highlight these real-world experiences that these doctors and nurses and other healthcare providers have, so that we can focus the attention of the American people and the Congress on solving the real problems, not the rhetorical problems.
In this county of 20,000, healthcare providers say they're doing all they can to meet demands, but the problem is just much greater than they are. They have their fingers crossed the president's healthcare plan will help meet their needs. In Troy, Lisa Conklin, News 2.
President Clinton also met with concerned citizens at a school in Troy before leaving town, and he isn't through with North Carolina yet. Later this evening, he will host a town hall meeting on health care and crime. The president
south of the Piedmont Triad in Montgomery County. The president stopped to talk to more than a few people on his way to the Montgomery County Memorial Hospital. He says this hospital is typical of the problem in rural America. There is one doctor there for every 7,900 patients, when the national average is one doctor to every 3,000 patients.
My roots are in a county a lot like this one. And I sometimes think in Washington we lose track of the human face of America's problems.
Well, people all over Troy were very receptive to Clinton talking health care because they say he was strong on details.
Those details are in our background report this afternoon.
There are 81 million Americans who have pre-existing conditions.
The president first outlined what he called the crisis. That's that 58 million Americans go without insurance each year, that 81 million Americans have pre-existing conditions, and that 133 million people have lifetime limits on coverage. What he wants is to give everyone guaranteed private insurance. That means comprehensive benefits without lifetime limits and insurance that can't be taken away. He wants people to have a choice of doctors and coverage plans. He wants what he calls real insurance reform, which means your insurer can't drop you or raise your rates if you get sick or you're older. And he wants to preserve and add to Medicare coverage, making sure Medicare adds coverage for prescription drugs and long-term care. It's a plan people who listen to him today say they like.
It makes sense. I am on Medicare, and I'm a state employee, a state retiree. I have a lot of these things that people don't have, and everybody ought to have what I've got.
If we're going to take working together, we got to talk to our congressmen and tell them what we want, and I think it's a good plan.
In fact, the president encourages people to call and write Congress so that some sort of health care reform gets through this year. If you want to hear more of the president on health care, he's holding a televised town meeting from Charlotte tonight. You can see it on WXII at 7:30. As for who pays, the president said again today that we all will, with the government footing the bill for people who can't contribute.
Most saw more of the entourage that gets the president where he's supposed to be than they did of the commander-in-chief. But shortly before 10:30, things started looking up. And then as the locals looked on, Bill Clinton stepped out of Marine One looking presidential with Secret Service and Congress people in tow. If you had this position, you were in luck. But for the folks back in the bullpen, this was as much of Brother Bill as they would see. To get attention, they improvised. So did they get much out of seeing this moving hairline bobbing and weaving through the front of the crowd?
Well, we saw about this much of him. We saw his hair. You saw his forehead.
But then sometimes a simple press of the flesh can do more than any solution to world problems to cement a voter's loyalty.
Okay, Clark got to shake his hand. Let me get your hand. Right up there in the front.
And people were pressing the flesh of the flesh that pressed the main flesh before it was over. So that little kid has been shaking everybody else's hand in Troy. But it was very interesting because not often do people in small town situations get to see the main honcho. Today, Bill came through town. He gave a couple of thumbs up. And for the people in Troy and Montgomery County, that was enough to make them smile for the day.
Yeah, if you got close to Bill Clinton, then I want to be close to you.
That's exactly what they were doing.
Okay, thanks a lot, Beatrice. Sure. Well, health care reform, of course, is not the only subject that is topping the Clinton agenda today. Rick Jackson joins us now live from the NBC News Channel with other topics that the president will likely be talking about. Rick, what's the story from there?
Jesse, this is ground central. What they've done here today is practice, practice, practice. There are people from NBC, people from the White House, people from Secret Service, all running about here very hastily. You can feel the excitement in the air. There's actually an audience right here to my left as I speak to you. This is the president's monitor. He'll be using this to speak to the people in Tennessee and the people in Virginia who are also joining us from around the country. This is the chair the president will be using. He'll just sit right here for roughly 90 minutes, but as you heard, he likes to go long, so we don't know what could happen. Now, I have scanned some of the questions people will be asking, people from not just Mecklenburg County, but York, Pitt, Guilford, Union. The list goes on. Some of the questions range from health care to housing to the POW situation in Southeast Asia. But one thing the president wants to talk about is his plan for fighting crime.
Won the NCAA championship Monday night.
60 years ago, we had a chance to guarantee health care coverage for all Americans, and we passed it up. And we have really played havoc with a significant percentage of the American people. We can do better than that.
The president couldn't have chosen a more ideal location. Montgomery County is in a health care crisis with only 3 primary doctors to serve 28,000 people.
While the national ratio is 1 primary care physician to every 1,500 people, ours is 1 to every 7,600 people.
At the county's only hospital, the president sat down at a round table with doctors who tell him they are overworked and underpaid.
In flu season, which we've just finished, I averaged working 100 to 110 hours a week. I don't ever go home feeling like I've finished my work.
Clinton told the doctors his health care plan will help. He's offering tax incentives for doctors who will work in rural towns like this one.
I mean, nobody can work 80 or 100 hours a week forever. You burn out.
That's right.
Town people say this is the biggest thing that's ever happened in Montgomery County. Just like the president, they worry about health care.
I'm really concerned about the older people, especially because they may not be able to work and earn enough money to have some of the health care.
This is the first time that a sitting president has ever visited Montgomery County. People here say they are desperately in need of help with health care. And President Clinton says for the government to do nothing is no longer an option. Margaret Johnson, Newswatch 12, Troy.
Descending on a small North Carolina town with the precision of a military campaign, the White House brought new charts and slogans chosen by Clinton pollsters. Gone are the old bureaucratic-sounding buzzwords like regional alliances and employer mandates. Repackaged to appear more consumer-friendly, the new selling points are choice of doctor and guaranteed private insurance.
Guaranteed private insurance. Keep your choice of doctor.
It's guaranteed private insurance. This is not the government taking over health care. It is guaranteeing private insurance to every single American.
How many times in this interview have you mentioned private insurance?
I'm going to mention it time and time again because this plan provides private insurance no matter what the opponents say.
Since the president proposed health reform last fall, opponents have been hammering away at it, and the White House sales pitch has been muddled. Today, the president blamed it on the special interests.
And all we ever hear from are lobbyists. Then the real world experiences, what's really going on out here in the heartland of America, gets lost in a cloud of hot air.
But the Clinton team is also being blamed.
One of the problems the president has had is they talked in governmentese. People don't understand that. It has to be translated into what it means for the average citizen.
Today's message was also aimed at rural America. The Clinton plan offers tax credits to doctors who work in rural areas. In this community of 28,000 people, there are only 3 doctors.
I have 8,000 active patients in my practice right now.
8,000?
I have over 8,000.
When's the last time you slept?
People are saying they want some kind of health reform this year, but by a slim majority in the latest polls, they don't want the Clinton plan. Andrea Mitchell, NBC News at the White House.
With Congress, White House correspondent Rita Braver reports.
President Clinton traveled to rural North Carolina today for a series of carefully crafted photo opportunities, the start of a new health care blitz.
These things come in waves. I mean, the American people are thinking about it again now.
At a local hospital, the president met with a handful of country doctors and other healthcare workers who complained that they're suffering under the current system.
And I have 8,000 active patients in my practice right now.
The president promised his plan would improve rural health services and acknowledged that this small meeting was designed to get on television.
Well, yeah, that's the idea.
The government is paying for TV production and satellite time to broadcast the president's message live.
And all we ever hear from are lobbyists. Then the real world experiences, what's really going on out here in the heartland of America, gets lost in a cloud of hot air.
But insurance company lobbyists say the real problem is that many Americans don't like aspects of the Clinton plan.
In many respects, what the White House has been doing is shooting the messenger, but not really addressing the message. Our message is very similar to that of the president, and the White House knows this.
Really going on in the heartland of America gets lost in a cloud of hot air. Here's ABC's Britt Hugh.
The president's helicopter took him into rural North Carolina today, one of many stops in a busy week devoted largely to a job he had hoped was already done, the sale of his health care reform plan. With crucial votes ahead in critical House committees, it is in serious trouble. So as Mr. Clinton made a personal appearance in Troy, North Carolina, the White House made the event available by satellite to any station that would carry it. Not only his speech, but also a meeting with doctors and hospital officials.
So I think we just have to keep hammering this home, not just on local television. I'll be grateful if you put this story on national television tonight.
Tonight, Mr. Clinton will hold a town meeting in this studio in Charlotte. And later this week, similar sessions in Kansas City and Minneapolis. Satellite coverage will extend the events to stations reaching nearly 10 million people in the home districts of numerous congressmen whose votes Mr. Clinton needs. Mrs. Clinton is also on the road, today with senior citizens in Rochester, New York. Last night in Chicago with Chairman Dan Rostenkowski of the pivotal House Ways and Means Committee. Kansas Democrat Jim Slattery, a member of the equally pivotal House Energy and Commerce Committee, will get a personal visit from the president later this week. He said today Mr. Clinton has a lot of work to do.
One of the biggest problems the president confronts right now is the American public's overwhelming skepticism about the involvement of government in this area beyond where it already is. There's just enormous distrust of government in the country today.
Working through a special interest group it helped organize, the Health Care Reform Project, the White House has retooled its health care message. It downplays not only the role of government, but also what it used to call the employer mandate, the requirement that all businesses cover their workers. The requirement is still there, but in speeches and new TV commercials, it's phrased another way.
I don't agree with the president on everything, but on providing health care at work, he's got it right.
Montgomery Memorial Hospital, Clinton learned this area has only 3 doctors for every 7,600 people. The national average is 1 in 1,500.
I don't see how your hospital is functioning with doctors where a slow week is an 80-hour week and a fast week is a 110-hour week.
The president met with hospital staff, heard their stories about the inability to deliver adequate medical services, then made his pitch for reform.
You have here the infant mortality rate in this county is well above the statewide average. Why? Because you have a whole lot of pregnant women who only have 7 prenatal visits when they ought to have 12.
The president told a receptive crowd of Montgomery County civic leaders the emphasis needs to be in rural America, where hospitals have a tough time recruiting doctors and people often go without insurance.
If we do nothing, for a couple of years anyway, people who get their insurance through big businesses and through government, like I do, will continue to get good health care at reasonable prices. The price of that will be putting price squeeze on everybody else.
Certainly, expectation is high that even though the prime subject of tonight's town meeting here at the studios of NBC News Channel is crime, but certainly the issue of health care reform is going to definitely come up. Everything gets started here at 7:30, the live televised broadcast that you can see on WCNC television, lasting until 9 o'clock this evening. The crowd is already here. Rick, AC?
We're all looking forward to that. Thanks,
Certainly
Chris.
Are. Thanks. So you're sitting at home wondering what's so special about Troy, North Carolina. Here are some facts about that town. 2,600 people live in the Montgomery County seat. Many of them work at the Capo Rug Mill or several hosiery mills in the area. We're also told more timber is cut in Montgomery County than in any other county in this state. And in case you're wondering, it's about an hour and 20-minute drive from Charlotte to Troy, about 1 hour from Greensboro. It's about an hour and a half from Raleigh.
And it is, of course, the biggest news to hit Montgomery County in quite a while. This is the first time a sitting president has come to this crossroads between the Piedmont and the Sandhills.
Visit brought out quite a few well-wishers and citizens with their very own agendas. Beatrice Thompson is live outside the headquarters of the NBC News Channel with more on the town of Troy and the president's visit there.
Oh, Rick, Alicia, for the press corps that follows the president, this is just another day in the schedule complete with security, and they have an agenda for the president that wants to push his health care plan. Well, for some people, a presidential visit is a key time to push agendas of their own interests.
They came from across several counties in the Piedmont and the Sandhills. Their objective? To see the president, maybe say a word or two, tell him how they feel about things.
If Bill stopped the car long enough, I would tell him that we have to feed minds.
Folks like Carol took up positions on their front lawns along the motorcade route from the hospital to the school. She says she wanted to make sure that money is found for more than just what some may consider the big-ticket items in the budget.
And libraries feed mines all across, 15,000 of them across this country. Feed mines.
John Kivamini was not so lucky. A veteran of World War II, he had come from his home in Lincolnton, not to talk about the president's health care plan, but to question why benefits are cut to veteran centers. His big sign says how they affect this ailing veteran, but the president never saw him. The closest John got was 3 blocks away from a fast-moving head of state.
And I think sometimes that's a feeling that some people have, that they may have an agenda, they may have questions, but how do you get close enough to tell the guy who may be able to do something about it? Well, tonight here at the NBC News Channel and with the help of WCNC TV, we will have people. The town hall meeting will begin. Bill Clinton will be here. He will hear some of the agenda of local people. They'll hear what he has to say, and before it's over, maybe there will actually be a meeting of the minds. Bill, Alicia?
Okay, sounds good.